Echocardiogram.
Introduction.
Please point to the heart valve.
Choose one of the following options.
Correct. This is the valve separating the left atrium from the left ventricle. The main function of the heart is to load the blood with oxygen.
Select true or false.
Correct. The main function of the heart is to pump blood to the lungs and to the rest of the body. The echo test can help the doctor diagnose things that cannot be diagnosed with an EKG alone.
Select true or false.
Correct. Coronary artery disease can cause a heart attack as blood vessels of the heart get clogged.
Select true or false.
Correct. When blood vessels of the heart become clogged, a heart attack could happen. The echocardiogram uses echo technology much like an ultrasound machine used on pregnant women to look at the baby.
Select true or false.
Correct. An echo is painless.
Select true or false.
Correct. An echo is painless. You will feel some pressure on your chest when the technician presses on the transducer. The lubricating gel may feel slightly cold at first. An echo may require you to stay in the hospital overnight.
Select true or false.
Correct. The echo is an outpatient procedure, which means you will go home after the test.
Thank you for using Explain.